Just would like to begin with thanking everyone for their time tonight, especially since we're starting this a lot earlier than we have in the past. We have an hour to cover this content, so if all of the referees could keep their questions till the end, it would be greatly appreciated. Our presenters for this webinar are Ellen Gemiani, Jen Burke, Shelley Ballantyne-Talmadge, and Ed Reisman. The purpose is to provide our referees with information on how to handle basic medical situations at competitions should trade medical coverage not be available. Additionally, a lot of this is going to stem from experiences from last season. On top of that, the discussion at Governing Council, and then, of course, the ISU Communication 1951, which we will go over. So at this point, I will pass it off to our medical team.
Okay. Thank you, Mia, and thank you to the referees for participating in this. You guys are tremendous for stepping up and getting the information and then implementing it. And I think we had some issues, well, I don't say issues, but incidents that occurred last year, and they were all handled in a very professional and accurate manner. So congratulations and thank you for all of that effort. I'm going to be talking about a lot of the rules and the preparedness stuff. Jen Burke is going to talk about basic illnesses. Sherry is going to speak on concussions, which is always a busy topic. And then Ed Reisman is going to talk about musculoskeletal and blood issues. Some of this may seem repetitive for some of you if you've done this before. But, you know, just like anything else, the more times you hear it, the more second nature it becomes, and that's always helpful, especially when you're in a crunch situation on the stand or in the midst of an episode. Okay, next one, Mia, for me, I think is just an overview, which I just did, so we can keep moving. Okay. The U.S. Figure Skating does have a liability rule, which basically releases, or as much as any liability clause can, releases U.S. Figure Skating and its staff and officials from responsibility, not total responsibility, but when the athletes sign up to participate in a competition, there's an inherent understanding of the risks and dangers, potential injuries, etc., in participating in sport, and especially specifically the sport of figure skating. So we do have some legal background for being able to say, yes, you guys are entering into this essential contract with the competition that, okay, there's a risk involved, and you understand that there's a risk involved. Now, of course, we on our side want to do everything possible to keep that risk to a minimum, or should unfortunate situations occur, be able to manage it appropriately. Next slide, Mia. So this year, I think after some incidents that occurred on the International and the ISU Grand Prix Series last year, the International Skating Union came up with communication number 1951 pertaining to on-ice medical emergencies, and setting forth a written protocol which I think is going to be helpful for all concerned, particularly for the medical staff. I think it outlines a good recommendation regarding how many folks should be present at events and where they should be stationed, outlines and recommendation on the communication with the referee by the medical personnel so that all parties can know what's happening. Basically states that when an emergency occurs on the ice, that any medical personnel that are present feel requires attention, they will communicate with the referee that information, and then the referee will clear the ice surface. The medical personnel, along with the team physician of the skater from that particular country, this is pertaining to the international event, will be allowed to enter the ice and tend to the athlete. And then the athlete will be removed from the situation, evacuated, and then taken to the medical room. You can go to the next one, Mia, to be assessed. That team physician, if present for that particular skater, or the local medical chief officer will make a determination if the skater can continue. And then it will be up to the referee to determine finally, with advice from the medical staff, whether or not the skater is allowed back and to compete. and then there's some forms for us to fill out. I think most of you have probably seen this, and number 10 on this outlines the regulations regarding stops and restarts in that, and I think that's been in place for a while. I know on the team leader call there was some discussion on just what that meant, and I think they were going to try to clarify some of that, or if anybody has questions on that, we should probably discuss that with the appropriate individuals. Next one, Mia. So there is a handout which will include all of this information for you guys, and Mia, that's available on the website, or do they get it in the handbook? Like an official communication?
Well, we have a medical addendum within our agreement to host that also has a standard of care, which all the LOCs have received. We're working, Peter and I, to update that for this season to make it a little more straightforward, because it's been really based upon a Skate America or U.S. championships, and that's not always relative at the regional and sectional level. So we're trying to make medical a little more accessible for them, opposed to being very scary and scaring off their volunteers. So we do need an update on that, but they have received it.
Right, and then in terms of the information, on the slides and that are available for them to review or keep a copy of if they want as well. Am I right?
Yep.
Yeah. Okay. So as you go into an event as the referee, some questions to pose to the local organizing committee. Number one, is there medical staff? In which case, if there is, you probably want to know what their qualifications are. Are they sports medicine trained, or do they have any experience with skaters and the whole process of figure skating? If not, you might want to kind of sit down with them and discuss how the whole system works. And if you have medical staff, then your responsibility in terms of making those decisions, of course, is gone. But it's always helpful to know who's around. You want to know where they're located. Most of the time we'll try to be positioned at an entrance or exit to the ice. Establishing how you're going to communicate, because unfortunately there's not always radios or phones or whatever, so you need to establish whatever's feasible at your particular location. How do you get a hold of the medical staff? What's the ambulance response time? Is the hospital close by? Usually those things, again, are outlined, as Mia pointed out, in the medical preparedness materials that the LOC has to comply with. Have they got all the emergency protocols in place? AED location, where it is. Did somebody in the rink at least know how to use it? If you don't, etc. And do they have an appropriate plan for any blood on the ice? Next slide. What happened to the, they might still be Sherry in your part, so there were two other things on the new rules from Governing Council, but I'll just do it.
Okay.
With Sherry, okay?
Yeah.
Okay. All right, so the first part that Jen Burke is kindly going to talk to us about is basic illnesses and what you might encounter and how you might handle that. So Jen?
I'm here. Good evening. I think this slide might be fancy, so you might have to click through to get everything. Yeah, right. Just like that.
Oh, and we
so good evening. Thanks everyone for taking the time to do this. Every once in a while, as a referee or a judge or whomever is involved, you're going to come across an athlete who may or may not be ill. So my job is to kind of review a few things that you might want to consider if there is a question about whether or not this skater should skate. So a couple things. Fevers, we in medicine define a fever as a temperature that's greater than 100.4. In my office, I have people coming in all the time telling me about their fevers of 99.5. Really, you can have a 99.5 walking in from being outside in Arizona. So it's really 100.4. And other things that are important to consider when you're confronted with an athlete with a fever is how long it's been going on. If a fever's been going on for half a day, it's not as big a deal as if someone's had a fever for 2 or 3 days, and the reason for that is really dehydration and the severity of the illness. If a temperature is greater than 102, they probably shouldn't skate. How are you going to know this? It's not your job to know that part, but if you're confronted with someone saying, hey, the skater has a temperature of 103, they look terrible, and you're asked whether or not they could participate, you can guide them and suggest that perhaps not. Other symptoms to consider body ache, sore throat, earache, things that would certainly make you think that someone is sicker versus just looks bad because they're anxious before their event. Next slide. And all the, yeah. So vomiting, diarrhea, dehydration, this comes up very, very often. We, the medical staff, manage this. I would say I'm probably like every single event. There's someone who has something, and a lot of times people come and they're nauseated, they might throw up a little bit, a lot of it is just anxiety and nerves, but sometimes it's not. Sometimes they get off the plane or they arrive at the event and they've been having diarrhea for a week and they've been throwing up and they look pale and drawn and they look terrible, and the big issue is that they're dehydrated, and it's difficult again for them to participate. So these are questions that you can ask, but also just things to be aware of when the situation presents itself. One of the measurable parameters that we use is tachycardia. Tachycardia is a rapid heartbeat. So a normal athlete would have a heart rate probably between, say, 50 and 80, maybe 70, and an anxious athlete might go up into the 90s. But if someone is hanging out and their heart is just going well above 100 and they look terrible, that is a big red flag to help them consider withdrawing from the event. Of course, dizziness. Dizziness is a symptom whether they're ill or if they've got vertigo or something like that would make it extremely difficult to participate. And one of the questions you can also ask is how much weight they've lost. Sometimes they'll say, yeah, I've lost 5 pounds this week. I've been throwing up and having diarrhea. Well, that's a big red flag too, because that's 5 pounds of water, and that makes it difficult. Next slide. And there's stuff. So if you're confronted with a situation where you need to kind of ask some additional questions, things to consider in your recommendation would be, is it the long program versus the short program? Obviously the short program is a lot easier to perform than a long program. And it's also important to talk to the skater directly. Parents and coaches oftentimes have a vested interest in the skater performing, and we all can get excited and in the moment and be challenged to make good decisions. So it is important to talk to the skater one-on-one and asking them, do you think you can do this? Reality, like look in their eye and see what they say, and then also asking them the questions directly. Very often you get stories from the parents, stories from the coaches, but when you talk to the skater you get something completely different, and I would hope that you wouldn't get caught in a situation like that, but should you, these are things to consider. Next slide. So another big one that you can be confronted with, and I've heard cases from referees about, is the athlete who looks like they're short of breath and you're worried they're having an asthma attack and they could be, they could pass out and this would be a big issue. So how do you tell the difference? It's a little bit hard to tell sometimes, but there are cues, and it's important to think about them because it's much nicer when you can sort of know in your mind this is hyperventilation. They're gonna be fine, versus this is asthma and I really need to call 911. So when someone has asthma, they have a harder time breathing out. So they'll take a breath quickly in, but then when they breathe out, it's a long, prolonged exhale. And that's because their airways are tight. It's hard to get the air out. And when someone has anxiety or hyperventilation, which is what we see most often, you'll see that they have they breathe in more slowly. So if you kind of like try to close off your throat as you're breathing in, it can sound awful, but when you relax it, all of a sudden it's much easier to breathe. And when people get very anxious or they start hyperventilating, very often they'll kind of have this whistling or drawing sound in when they take a deep breath, but then they exhale, not a problem. So the exhale is the key to differentiate between the two, but it's probably easier to tell the difference on the inhale. Very, very often, the athletes who are asthmatic very often get anxious too because they don't want that to happen. So it's hard to tease it out, and of course they can use their inhalers and things like that. Again, that's something that's more of a medical role, but if you've got an athlete who looks kind of pink and they don't look terrible, but they're just looking uncomfortable and they have these long inhales where it feels like they're kind of sucking air in, it's really hard, that person I'm less worried about than someone who is taking a breath but it takes them a longer time to get it out and they look kind of pale and maybe they look a little blue around their lips. Another thing is when people hyperventilate, they'll get tingling around their lips. So they'll get completely freaked out by the tingling around their lips, but that is a sign of hyperventilation. And although, that's concerning, it's not as concerning as someone who's having an acute asthma attack. Next slide. So other things that you may be confronted with, you know, we don't see too many adolescent athletes coming in with recent heart attacks, but our adult population potentially, I suppose, could. And, you know, just rules of thumb, you know, if someone comes in, and I would say in medicine our most non-compliant population are probably men in their 40s and 50s. And if you have an athlete, for example, comes in, yeah, I had a heart attack last month, and well, I haven't trained much, but I'm here to compete. That's a situation where you really would want them to have a note of clearance from their cardiologist, or at least have gone through stepwise care. I can't imagine that really happening, but maybe I can actually, which is why I have this big long thing. You know, rule of thumb, most people aren't going to start training until 6 weeks after a heart attack. They're not going to compete for longer than that. And 1,000 things matter. How big is the heart attack? Do they have rhythm problems, etc.? Have they done cardiac rehab? It's a big deal. So if there's any question, this is a situation where I certainly think you can request a doctor's release. Mono, we do see that in the adolescent athlete and athletes in their 20s. And the rule of thumb with mono is that they can certainly train and compete, but we hold them out for the first 3 weeks, and the risk is splenic rupture, and it's not so much trauma that causes it, it's usually spontaneous, but the rupturing of a spleen can be a fairly catastrophic situation. So if someone has been recently diagnosed with mono, say a week ago, and their doctor is unaware that they're there, that's someone who I would require a physician note to continue. Not to mention they'll probably be exhausted, so they probably won't be there anyway, but just in case. Contagious rashes, not as big of an issue in figure skating as it is in wrestling, for example, except if there's a partner involved. But these are things to me that don't not necessarily disqualify an athlete, but to figure out what it is and what kind of protection you can provide their partner. Pregnancy, this was a situation that arose several years ago, and it, you know, and this is the situation that, you know, we do have that release in the beginning that Ellen talked about, where adult athletes particularly will, you know, sign a release saying that they're taking responsibility for their participation. As a referee, if it's uncomfortable, I think you can certainly request a note of clearance from their OB, or if there's medical staff involved, they could certainly talk to the athlete. But you know, when adults make a decision to participate, it becomes difficult to change their mind, except if it is truly a danger to them or a danger to their partner, and they're unaware of those risks. So, kind of in summary, use common sense. If you know, if someone is in a danger to themselves, that's an opportunity to recommend that they perhaps withdraw, or they bring you a physician's note if you're concerned. This is going to come up more in the concussion talk, so I won't talk too much about that. And that's it, really. So if there's questions, we can address them at the end. And thanks for taking the time to listen tonight. I'll introduce Sherry Ballantyne. She's up next. She's going to be talking about concussion. Sherry's a primary care sports medicine doctor who works in Boulder.
Hi guys, so this is a beefy topic, and certainly one that there's a lot of confusion about, mostly at the fault of the press. So we tried to give you the most amount of information that will help you to make the decision that you need to, which is usually a game time decision. So let's get into it. Can you advance the slide, please? So the picture that you were seeing is evidence of the fact that the brain floats in water. And so oftentimes when you're talking to people, you're going to hear sometimes this misconception that helmets or headgear are somehow going to protect someone from getting a concussion, but we can't do that. What that is protecting them against is from skull fractures and facial fractures. The concussion is an actual brain injury, and the other thing that's really important for you to know is the athlete doesn't always have to hit their head to actually sustain a concussion. A concussion happens because of shearing forces that we call that happen in the brain. So the person sustains some sort of a hit that causes their head to move a direction, and the brain may hit in the front of the skull or it may hit in the back. We don't always know where the brain actually hits, but it can be caused by a whiplash injury. So a lot of times it's really important for you to know that if an athlete is acting kind of funny and you're suspicious, but they say, yeah, but I didn't hit my head, that doesn't always necessarily mean that they didn't get a concussion. And So just you need to be aware of that it can absolutely happen with a whiplash injury. The other thing that we hear a lot when people have misconceptions about concussion is that, well, I didn't pass out, so I didn't have a concussion. And actually, most concussions are going to occur without a loss of consciousness. So yes, you can lose consciousness when you get a concussion, and that is concerning, but it doesn't necessarily mean that just because you didn't lose consciousness that your concussion is any more or less severe than someone that lost consciousness. So it's important to know if someone loses consciousness. We talk about a duration of more than 5 minutes of loss of consciousness is something that's important, but if you have a situation as a referee where someone says, let's say for instance there was a practice and they saw a pair and the girl went down and was dropped and she didn't necessarily hit her head, but she's acting kind of funny now, she may have sustained a whiplash injury and she may not have lost consciousness, but she very well may have a concussion. So those are really important things to have knowledge about in case you get questions about that, because a lot of times people that are concussed are not going to necessarily want to sit out, and these are important things that you need to have clear when you're discussing it. The other thing that makes concussion really difficult is that every concussion is different for every athlete, and every athlete's concussion is different for them. So their first concussion may look completely different than their second concussion. We have this saying where if you've seen one concussion, you've seen one concussion. And so if someone has a suspicion that they may have had a concussion, sometimes their symptoms are not completely immediate. So it may take some time for it to evolve. So we'll get to a slide later that is kind of the gold standard for what you need to do. But if you're suspicious that someone might have a concussion, it's important for them to also know that these symptoms may continue to evolve, sometimes even into a 24-hour time frame. So they might not necessarily know. They might just present with neck pain and a little bit of a headache, and then it's the next day that they start to get really fuzzy and they are not acting like themselves. So the biggest thing that we've done over the past several years with concussion is really try to make sure that we give education, because education allows you to then recognize the injury. And if you are able to recognize that injury, this is an injury there you can really, really make a big difference in. Can you advance to the next slide, please? So this is a laundry list of the symptoms that you can get with concussion. You can see it's quite exhaustive, and for the sake of time I won't necessarily go through all of them. I would recommend that if you're covering an event or you just want to have this kind of handy so that you can be aware of all the variety of symptoms that you can have. Concussion is really difficult because it's a symptom-based diagnosis. We always tell people a concussion is not something that you can necessarily see on the CT scan or an MRI. You can certainly see it in the athlete. These athletes have a very distinctive look to them. They look like they've been hit over the head. They look like they've sustained an injury. They can't really focus. Really things that are really helpful in the moment would be to ask them where they were in their program. Is this a short program or is this a long program that you're doing? What's the name of this event? What's the name of the rink? And you'll see that in the list there where they don't recall the program, they don't recall the actual event. So it can really be a list of things like actual physical symptoms like nausea and vomiting and a headache, but sometimes they can be more emotional. They'll have personality changes, and sometimes they be more tearful. They might be more irritable, and overall you'll see that the athlete is just not themselves. They're not acting like they normally do. So I would just recommend that you gaze at this laundry list of symptoms just to familiarize yourself with all of the different kinds of symptoms that can happen with a concussion. Can you advance to the next slide, please? Great. So this is their example we just kind of talked about, and this also came up a couple years ago, and we have gotten asked this question before. What do you do as a referee when you see a skater that falls, and let's say in the short program, and they strike his head on the ice, and is he going to get up right away? Does that person have loss of consciousness? One thing you could look for, if they fall really hard and hit their head and it takes them a while to get up, does that skater get up and seem to be able to continue on with their program as they should, or are they skating kind of aimlessly around and making poor decisions as far as which way they're trying to go? Do they get up and then fall again and then fall again? And that's kind of when we get the questions of when do you stop a skater, and that's kind of what prompted us to discuss this. So those are the kinds of things you should be looking for, and the concussed skater is not a reliable patient. So they might continue to get up and they might not be aware of what they're doing. So Those are the kinds of things that you need to be aware of when you're looking or suspicious for someone that might have had a concussion. Next slide. So if there's, with concussion, especially with what's in the media, we always tell people the most important thing is, if you are suspicious that a concussion has happened, if you think that those symptoms are present, get them off of the field, get them, in this case, get them off the ice right away, and ask them specific questions. Pull them over to the side of the boards and say, okay, what event are we at? What rink are we at? And what were you doing when you fell? If this person can't remember that they were just up in a lift and they fell, or they were doing a combination, that's a problem. And so we found that it's really important for us to ask those sport-specific questions, as opposed to what year is it, or what month is it. The sport-specific questions in the kind of heat of the event is really important to ask. So those are good things. If they don't know what they're doing, a good chance that they've got a concussion. Next slide. So the other thing, as we mentioned before, a concussed athlete is really not a reliable athlete. You can tell them something and they won't remember it. You'll ask them if they remember having a discussion, and they will have no clue that you actually talked to them. So if your skater is a minor, make sure that there's some sort of a guardian or a parent or someone that you can relay good information to, and saying that, hey, this person, I'm really concerned that they have a concussion. It's going to be really important that they're evaluated by a medical professional. Obviously, that's easier if you have the luxury of having medical at your event that can help you to clarify this, but it's really important that the information gets passed on to someone that we can actually feel confident can remember what is being told to them. So the bottom line for anyone with concussion, the safest thing for you to do is, if you suspect a concussion has happened, that athlete should never be allowed to return to play on the same day. It's just not worth it. They really need to be seen by a medical professional so that a full evaluation can be done. There are definite dangers with returning a concussed athlete to play. Not only could they have some secondary injury because they're not completely with it, there are some other pretty significant scary things that can happen. So it's just safer to keep athletes out if you suspect that they have had a concussion. And then if they have had a concussion, they really need to have a written clearance from a medical professional. And you'll see sometimes that from state to state, I've appreciated this, each state has their own kind of guidelines as to what a medical professional means. So it may be a nurse practitioner, I have found, it may be a physician assistant, but make sure that you're looking to see that it's not, let's say, a massage therapist or someone that clearly wouldn't be maybe allowed to return someone. But they really need to have that clearance from an appropriate medical professional. Next slide, please. So in the setting of concussion, the best thing that we can do, and there's been more and more about this in the popular press, and you'll hear all sorts of interesting things from families and patients as to what you should do when someone does have a concussion. But the bottom line is that we do need to let that brain recover. And we try to phrase it to people that you only have one brain. You may have two wrists or two legs that you might feel comfortable gambling with, but you really only have one brain. And so the first thing that we do when someone has a concussion is we give them a period of what we call cognitive rest. And really the big thing here is just kind of minimizing the stimuli that the brain has to process. So for our kids, it's, with the technology that we have, we want to minimize their TV. Video games is really something that they're just doing all the time. Screen time with, whether it's iPad or their computer. So try to minimize that. And then in addition to that, they really shouldn't be doing any sports. If they're on cognitive rest, they're in theory potentially not going to school, or maybe if they're an adult, not going to their job. So kind of say you can't really do those sports unless you can do those simple things like being able to read. And so they first start on both cognitive and physical rest. So that's something that you can recommend to them, or say if you've had a concussion and someone asks you what to do, you can at least advise them that that they should go on both physical and cognitive rest. But like we said before, it's really important that once someone has had a concussion, they really need that written clearance to come back. And if they don't have it, I would absolutely feel comfortable telling you that it's not okay for them to come back, because if they are still concussed and they go out and they have another injury or they have another hit, it could be a really big deal. So they need that clearance to return. The goal is for all of the symptoms from their concussion to completely resolve, and then they actually start what we call a graded return to play. It usually takes place over about a 4 to 5 day period. So that's something that needs to be also stated as well, that they have started their gradual return to play. The reassuring thing about concussion that we try to, even though concussion gets so much bad press in the news, is that really the reality is most concussions are 85 to 90% of concussions are going to get better in about a 7 to 10 day period. I will say, just for some clarification, the pediatric population, so 18 and under, they can sometimes take a little bit longer, more on the 2 to 3 week time frame, but in general, most concussions are going to get better. So, and you don't hear that in the popular press, and that's something important for you to have as a knowledge base, that really most of these are going to get better. Next slide. So here's the key points for you. With concussion, the other reason to make sure that they've been appropriately cleared to go back, any athlete that has had a concussion is absolutely at more risk for sustaining another concussion. So each successive blow that they have, it's possible that you're lowering a threshold for them to become concussed. So that's really important to know. And they a lot of times won't know necessarily if they have had a true concussion or not. It's not uncommon for us at all in the office or with athletes to hear them say, well, I'm not sure how many concussions I've had. I may have had 4, I may have had 3. I'm not sure if this one incident was a concussion. I just remember my neck really hurt and I had a headache. So it's important to have that kind of conversation with how many concussions they think they have had, or how many have actually been diagnosed. And then the other thing that's really helpful is if you think someone has had a concussion, it's absolutely a great idea to give them written instructions. Even if you are talking to a guardian or a coach or a parent, if you can write something down that you're suspicious that they had a concussion, that you're recommending that they get medical attention, that they get clearance to come back if they have been diagnosed with a concussion, it's really helpful, because those verbal instructions aren't really reliable, and it's important to get that. And then you just have to remember, just like many other issues with sports medicine with our athletes, that it's very common for them to underreport their symptoms. They don't want to get pulled, and they're becoming more and more knowledgeable that if there is a potential for concussion, that they very well may be pulled. So just be aware of that. If they're telling you, yeah, I'm fine, but they look like they're in la-la land, it's a good chance that they're really not telling you the truth. So just remember that, like we said, the younger patient population, which would be our 18 years and under athletes, they are more susceptible to concussion. Their brains are forming. There's more things going on with them from a cognitive standpoint and from brain development. So their recovery may be a bit longer. They may have some other complicating factors that will make their concussion take longer to get better. Next slide. I'll let Ellen take over on these here.
Thank you, Sherry. That was great. And I work with a lot of concussion patients as well. And the younger than 18 group, which for a lot of you, it's many events, is going to be the majority of your skaters. We have at Children's here in Boston, we have a really low threshold for calling something a concussion because the risk is just tremendous. You know, they are more susceptible to the injury. It takes them longer to get better, and you really have to pay attention. I've also had athletes, you know, they don't always know that they've had it. I've had football players come in, well, I'm not supposed to get a headache every time I block. Yeah, so they're not always the most reliable source, as Sherry has alluded to. So in the last couple of years, we've done these presentations, and the referees have implemented these concepts and have done a fantastic job. Last year, I believe it was, we had a few very spirited discussions, I shall say, regarding some decisions that were made and appropriate decisions that were made, but of course the skater and or family, coach, etc., were not satisfied with what had happened. So it was, the rules were then challenged at Governing Council this year in May, and I had the opportunity to be present for that discussion. And the strongest, well, the argument that was made on the side of that the referees shouldn't do that is that, well, the skater knows themselves the best, they know their body the best, and they can make that decision whether they can continue or not. And clearly, based on everything Sherry just said in the last 15 minutes, that's not the case. You know, if they're concussed, they can't make an appropriate decision. They don't have proper cognitive function. So, you know, I feel that you folks as the referees, as the observer of the entire event and an objective decision maker, if you don't have the medical backup and you are concerned based on what we've informed you of and what you've learned from these conferences and your own reading and et cetera, that athlete is not safe to continue, then you know, go ahead and make that decision. And like I said, some of these decisions were made last year and they were not popular and created some challenge, but the right thing was done in every case. So again, congratulations and thank you to the referees for doing that. You know, if you have medical staff available, obviously rely on them. But basically, the rule was not rescinded at Governing Council, and so it does stand that the referee can require a medical examination for fitness when they think it's appropriate. And when the medical exam is not possible immediately, they will determine whether the athlete can continue to compete safely. And of course, all of these things need to be taken into consideration that we've talked about, or risk to themselves as well as partners or teammates in the case of synchronized skaters. Next slide. The stops is, again, that's part of just the basic rules. So if the referee feels that there's risk to the athlete from an injury, they do have the power to stop the event or stop the program. I know that none of that is ever done without great thought and consideration, but you do have that ability should you have concern regarding that. And that was also upheld with in the Governing Council meeting. Next slide. Oh, I guess this is our final. This is the little saying that goes around. You know, when in doubt, sit them out. You know, it's not worth the risk. And as I pointed out at Governing Council, the importance of a particular event should never outweigh the risk placed on the child and the potential risk for other injury or further injury from the concussion. So that just can't happen. So next slide. Musculoskeletal injuries. Ed Reisman is from Seattle, right? Or no?
Spokane, Washington.
Oh, Spokane. Okay. I'm on the East Coast, Ed. Everything's.
I know. I don't know anything past Denver, anyways.
That was very biased of me. So Ed is a primary care sports physician extraordinaire, has been working with figure skaters for a long time and does a fantastic job. And he's going to talk to us about musculoskeletal injuries and then blood on the ice.
All right. Well, thanks everyone for listening in here. I'm kind of covering for Dr. Malin Bradley here in this little section, but we'll go over the musculoskeletal injuries and blood injuries that you may encounter and hopefully give you some advice for management. So those musculoskeletal injuries kind of fall under these categories: bone, joint, ligament, or tendon type injuries. And so we'll touch on each one of them and what to kind of consider when they kind of happen. So on our next slide, as we talk about possible bone injuries, what we're really concerned about is there a break in the bone, or the medical word would be fracture. And probably the biggest telltale signs of something more serious going on is looking for some kind of deformity. So if the long bone in the arm or the leg is going off in the direction it doesn't belong, or a finger's going off in the wrong direction, that's probably a good tip-off that something's not right. Another good sign is the inability to bear weight, or it may be pressure, such as if there's a wrist injury, a bone wrist injury, and you try and press down your hand or your partner's hand, and it's too painful. We have to be sensitive to the fact that our young athletes that are still growing, they have these open growth plates in their bones, which are very vulnerable to injury. And the bone is more likely to, in a sense, break through the growth plate than perhaps in the middle of the bone, like an adult, which has more brittle type bones. On the next slide. So common skating bone injuries, hip, ankle. Actually, the hip's a pretty strong bone. It's a pretty hard one to kind of break. Ankle's kind of protected in the skating boot, so skaters, when I hear about them breaking their ankle, it's usually when they walk down the steps outside of the rink across the slippery parking lot or something. Lower leg or the tibia bone is susceptible. The wrist and the forearm and the elbow are other common areas in falls to hurt your arm. On the next slide, please. So usually to break a bone is going to be a forceful type of injury, and it's usually going to be the one where somebody is skating full steam ahead, falls out of the jump, and slides right over into the boards. It may be a collision with another skater, and so you've got the combined forces of two people running into each other. Sometimes it can be more of those awkward off-balance kinds of injuries that put the bone under too much stress. But you're really looking for a very forceful kind of hit collision that makes us all kind of wince, and then you have to be suspicious when the skater gets up slowly. Next slide. Joint injuries, what we're usually talking about are dislocations, and so it's when the two bones are no longer lined up at the joint, but something is kind of shifted out of place. And the ones that are most noticeable deformities are going to be a finger that's pointed in the wrong direction. It may be the bump that's the kneecap, which is no longer straight in front of the knee. Shoulders and hips are large joints. It's harder to kind of tell. There's a big deformity there, but probably the biggest tip-off is that that joint will not move like it in all the directions that it used to, and it is extremely painful to try and move. So those are the things to watch out for on joint dislocations. Next slide. So ligament injuries, a ligament, think of it like a rope. It connects two bones together, basically holds them in alignment. So we talk about ligament sprains, or there can be a tear in the ligament. Probably the most common one happens at the knee. So we have two strong ligaments that run down the inside and the outside part of our knee, but especially when our knee kind of collapses inwards, perhaps on an awkward landing when our edge catches wrong. Then we're susceptible to tearing at MCL or medial collateral kind of ligament. And twisting injuries make our ACL or anterior cruciate ligament susceptible to injury also. Usually with a ligament tear, the joint feels unstable, and that usually slows people down. They don't trust it. It feels like it's going to buckle and give out underneath them, and they're hesitant to continue to try and skate or perform. And the next slide. And our last section here is tendon injury. So a tendon are the fibers that connect the contracting muscle fibers to the actual bone. And tendinitis is the inflammation of that tendon attachment. These tend to be more of a chronic overuse type of injury, but of course when everybody ramps up their training just before the big competition and stuff, they're likely to flare up and become a much bigger issue, where before the competition they may have been managing it okay, but now it's hurting a lot worse or limiting their strength or movement because of that tendon inflammation and the pain that goes along with it. The outside part of your hip, the outside part of your knee are common areas to get some tendinitis. Shoulder tendinitis is rotator cuff tendinitis. It's going to be most common in your pairs, and I think our dancers that are doing more lifts now, as well as all the holding that goes on in the synchro skating. Most of the time skaters can safely compete with these unless the pain is so extreme that their motion is now limited, and we have to think about the fact that they may actually be putting their partner at risk because they cannot move, particularly like a shoulder, like they normally do. Next slide. So for musculoskeletal injuries, what do you do? Basically, if there's a major deformity, those need to be transported off and get some immediate kind of medical attention. You might have somebody right there who can look at it, and but if usually they're not going to have the equipment to really manage things properly, those joint dislocations, many physicians can often pop back into place, which gives people some immediate kind of relief. They'll still need further care, x-rays, etc., often in an emergency room. If they're not hurting too bad, you may be able to stabilize things, and a parent can take them in a car. Sometimes that's faster than waiting for an ambulance. But somebody's in extreme pain with a large-looking deformity or a gross-looking deformity, I would say that calling an ambulance may be very appropriate. Inability to bear weight or have a full range of motion, that's something that probably needs to be looked at over the next 24 hours or so, certainly before a next practice or a competition kind of session. Sometimes, though, what seems really bad in the beginning responds pretty nicely to some ice and rest through the night, and doesn't seem so bad in the morning. The pain is reasonable, and full range of motion is there, and it may be okay for them to try and skate and see how they do with that. In that immediate event, though, if they're basically limping on the ice, skating, their stroke doesn't seem right, probably very appropriate that they do not try and continue because of the fear that they may actually make their injury much worse than it already is. Next slide. So that kind of wrapped up our musculoskeletal session. So thinking about sports and blood injuries, and in this case we're really concerned about the transmission of infectious diseases and through body fluids, mostly blood. And the culprits, the bugs that we're worried about the most, are hepatitis B. HIV is human immunodeficiency virus, or basically the AIDS virus, and then hepatitis C. Next slide. So the transmission of these infections basically occurs when the infected blood or body fluid gets into somebody's open wound. It can also get in through the mucous membranes. Mucous membranes are basically the soft, moist skin. That would be like inside your mouth or nose. The other types of body fluids beyond blood, which would include like sweat, tears, saliva, sputum, the spit you cough up from deep in your lungs, respiratory droplets when you sneeze, have never been implicated as a way of transmitting some of these pathogens. There's actually never been a clearly documented case where we could prove that some occurrence in sports, some close contact in sports with somebody else's blood has actually caused another athlete to get infected. Even in healthcare settings, it's pretty rare, and it usually requires a large quantity of blood and some prolonged exposure to transmit that infection from the blood of the infected person into someone who's just been exposed to it. Quite honestly, the greatest risk for an athlete occurs through sexual activity or sharing needles and IV use, and it does not come from their sports participation. Next slide. So management, if somebody already knows that they have an open wound or cut, something that happened a day or two earlier and stuff, then really the pre-event preparation is the key. And people just need to use some common sense and know to wrap up or cover that wound well, something that's going to cover the wound and stay on through the course of their event or sport and not get ripped off, which will then make that wound susceptible to reopening and bleeding during an event. If something does happen and there is some bleeding, then being prepared to manage that situation. And I think a lot of us are well aware of universal precautions, which is assume any kind of blood or body fluid could be contaminated and should be treated that way. And so making sure that gloves, disinfectant, some waterproof bags to dispose of any blood or body fluid, kind of soaked bandages and stuff, is very appropriate and should be considered to have, you know, by the entrance to the rink so that things can be safely and quickly managed and people aren't scrambling for these things when it actually happens. If the bleeding can be stopped with some pressure and then kind of covered up, then you know, there needs to be some bandage material around. And I know I hate being on the sidelines of my my kids' own soccer games and realize that somebody scrapes up their knee, and for lack of a simple Band-Aid, people can't go back out there because there's no way to kind of cover up that wound. So it makes sense to think ahead and be prepared for some of these possible things and have some very simple supplies around. Next slide. So during an event, early recognition that some kind of cut has happened and there's some bleeding is really the responsibility of everybody. The athlete should recognize that they're dripping some blood or it's running down their arm. Other officials or coaches and staff that are on the sidelines may notice it, and really people should speak up and make sure and help the key person, which would be the referee, be aware that they've spotted this, and everything stops so that it can be dealt with appropriately. Athletes should come off from the ice as soon as practical, and that wound should be treated to get the bleeding to stop. If it can be controlled, then cover up the wound with a suitable dressing that's not going to continue to leak or drip blood, that keeps everything covered up, that can safely stay on, which is really critical if it's down on a hand or something and you've got a partner grabbing that hand. If there is blood on the ice, best thing is scrape it off and just cover it with some water to freeze. That's adequate. Blood on the costume, a few droplets aren't going to make any difference, but if there's a large patch of blood, it should either be covered up or H2O2 stands for hydrogen peroxide. It's very simple, it's very effective. Not always the best thing to keep costumes safe though. So there are commercial products like Blood Bluster and Formula 10 that are not going to make the color of the fabric bleed or damage the fabric and things. Sometimes you just need to change the costume. Next slide. Minor cuts and scrapes that are not actively bleeding, even though they look red, small amounts of blood on the costume, they do not require stopping the competition. The chances that that's going to transmit everything is basically nil, and I would not be concerned about something that minor. Again, a comment that many competitions occur without medical personnel present, so it really does put the responsibility on the officials and coaches to kind of know some of this and follow the proper management when blood is kind of spotted from a wound. Next slide. So some sample kind of scenarios. Collision happens on the ice. There's a few spots of blood on the ice where somebody's cut was kind of dripped a little bit before they could put their hand underneath the dripping blood and get over to the side and get it treated and stuff. Basically, someone can go out there, scrape the blood off the ice, scoop that up with a shovel. The wound can be covered up. If there's any blood on the costume, that can be sprayed or covered up with bandage material, and everyone can continue with the event. Different scenario, layback spin, grabs the blade, cutting the hand, keeps on skating. Now there's droplets of blood all over the place. It's just not practical to kind of scrape all those, and you're probably going to have to pause and consider resurfacing the ice. Last year a scenario was kind of proposed about someone who throws up on the ice, and I think you're just going to have to resurface the ice because there'll be solid particles in there that are just not practical to kind of scoop up and get off the ice before they freeze. Next slide. So some legal issues to kind of be concerned about. There is confidentiality. Basically, an athlete's medical information, it's up to them to kind of release it. Sometimes you may know that skater or person. You might be aware that they even have an infectious disease that they could spread to somebody else, but you are not the one to be sharing that. Only the athlete, or if it's a minor, their parents and stuff can share that kind of confidential information. In the same breath, though, the infected athlete actually has a legal responsibility to warn others if they think that they have had some bleeding and they are infectious or contagious to others. They do have the responsibility to alert other people about that possibility. And I think that would wrap up my section. Thank you very much.
That was great. So here, this slide has listed the contacts, all of our phone numbers, emails, should you have any specific questions or concerns, anything else. I think we have a couple minutes, yes, Mia, for questions, if anybody has them, or complaints, concerns. Yes, no, anybody?
Have you guys? Great job.
Have you guys heard the 1951 and everything already? Did that get communicated to you?
Yes.
Okay, great.
Will we get have access to the slides? Sorry, this is Kathleen. I'm just listening on my phone, so I haven't been able to see the slides. Just
yes.
I'm going to send them out tomorrow, so I'm going to consolidate the recording of the webinar and send that out as well as the slides to everyone. So you will have those.
All right, that's awesome. Thanks. Sorry, I'm just at a competition.
Great. Anybody else? Questions or?
I'm good.
All right.
Okay. Well, thank you all very much for taking the time. I appreciate the attention, and hopefully you learned something. Again, if you get off the phone and go, oh, shoot, I meant to ask, certainly email any of us. We're happy to answer and do whatever we can.
Thank you, Ellen, for taking the time to organize all this.
Oh, not a problem. You guys were great. Thank you, everybody.
And everyone. And Sherry.
Yep, thanks a lot, guys.
Okay.
Thank you.
Okay,
Thanks,
bye-bye.